Couple of reminders. Once we get to the Q&A section, we just ask that you all raise your hand so that we're able to bring the microphone over to you as opposed to shouting out. That way everyone online is able to hear as well. Today, we are honored to have Wade Norwood with us. And many of you may already know Mr. Norwood if you've lived in Rochester for any length of time. So he's a Rochester native, and he has held many community leadership positions. He is currently the senior leadership at Common Ground Health, which I'm sure most of us are all familiar with. He's been there since 2014 and in management since 2006. He's been in senior leadership since 2014 and in leadership since 2000 and management since 2006. I'm sorry about that. Mr. Norwood has been central to the nonprofit strategic planning process, pushing the organization to become a more effective change agent for all Finger Lakes region residents. He currently serves as the Chief Advancement and Government Relations Officer of the organization, formed from the combination of Common Ground Health and Rochester Regional Health Information Organization, RRHIO. This new entity combines RRHIO's expertise, providing a secure information exchange with Common Ground's data analysis, convening and community engagement expertise to improve health outcomes and advance health innovation. Innovation. His previous leadership roles at the state and local level include co-chairing the New York State Health Department's work group on healthcare workforce and co-chairing the region's systems integration initiative with Congressman Joseph Morelli. As a member of the Finger Lakes Regional Economic Development Commission, Mr. Norwood helps to guide funding for economic development, job development, and anti-poverty efforts across the region. Since 2009, Mr. Norwood has served as an at-large member of the New York State Board of Regents, which is responsible for general supervision of all educational activities in the state. He also serves as the chair of Regents Committee on Professional Practices. A leader in Rochester's faith community, he is president and senior pastor at the Holy Jerusalem Spiritual Church. Mr. Norwood is a graduate of the University of Rochester, where he received his bachelor's degree in political science. He and his wife, Lisa, reside in the 19th Ward here in Rochester, and they have 2 adult children. Please join me in welcoming Mr. Norwood to our audience here.
I don't know if any of you have ever had the opportunity that I just experienced. I took a new title effective the start of the year, and evidently they have rewritten my introduction accordingly, and it felt like having somebody read your obituary to you. I am absolutely delighted to be here, and I am really honored that you invited me back to talk to you a second time. My wife is absolutely befuddled, and I am charged to find why someone who has heard me would actually subject themselves to it again. But I want to come to you because when I was last here, I shared with you the regional data that we had released on the impact of the COVID pandemic on the regional health. And if you remember, that data really showed that all of the gains that we collectively have been working towards over the last 15 years in health improvement, real dramatic changes that we, providers, researchers, students, instructors, neighbors, employers, public sector, private sector, we collectively had made measurable, demonstrable improvements in regional health that were wiped out by the triple impact of COVID, not only the disease state, the economic impacts, and the social disruption. And the question that the data really raised was, if this is what's going on with the grown-ups, how are the children? And before I go into sharing with you the data release, and hopefully many of you have already been up on our website and have seen the media coverage, we've got a very great deep document in this. I'm just going to give you the surface. But before I do want to talk about the environment in which not only our young people are living, but we are living. And one of the commitments I made in the pandemic was that we as grownups have to stop acting as if everything is normal. We are creating psychic disconnect for children when we normalize that which should not be normalized. But I want you to know that when I was a child, the President of the United States was the coarsest, most crude politician to have made it into the White House since the Civil War. In fact, it was believed that he was a complicit actor in the assassination of his predecessor. That president was known to walk through the Rose Garden and blow his nose by just squeezing one nostril and blowing out the other. When he had gallbladder surgery, he stood in front of the national cameras, lifted up his shirt, and showed the scar. Very famous AP picture. He was so corrupt that his War Department, it had been newly renamed as the Department of Defense, only as a result of the Key West Agreement of 1948 between the armed forces of the US. But prior to that, it was the Department of War. And his Defense Department and the military lied on a systemic basis to the American people. And he was followed by a president who was even more corrupt, who ordered troops to fire on college students at Kent State. I just want to frame where we are by saying reality is reality. I remember George Wallace being shot. I remember learning the words to the song Abraham, Martin, and John. And has anybody seen my old friend Bobby? Political violence characterized my growing up. But there was no point at which my community did not hammer into me as a little colored boy on the west side of Rochester that I was born in the best family in the world, I was born in the best city in the world, and I was born at the best time to be alive. I think that there is something that we are doing by cursing the times in which our children are living that they are paying the price for. I don't have to introduce myself, and I hope I don't have to introduce the work that we do. But I do want to introduce to you the fact that this is knowledge that our fellow Americans do not understand. That what made the difference in my life were not those downstream factors of medicine, but it really was life and society and community. And my takeaway here, I hope, is that your presence demonstrates that the commitment of this institution to defining medicine as not just being disease and injury and mortality, but the entire spectrum of human experience. I want you to know that gives me hope, and that allows me to know that what we think of as Dr. King's dream is not something that is just passive, but that it remains active. Because it is absolutely true that there are people who do not believe in addressing the social determinants of health, because they do not value all lives equally. Joni Ernst said it quite plainly. Everybody's gonna die. We understand that it is absolutely possible to look at that burden of disease and that burden of death and see that when it is disproportionately and inequitably born among us, that it is something that we have to address. And I would say to you that what is my greatest source of hope and inspiration is the very same thing that fueled the 20th century civil rights movement. The absolute audacity of hate. It took seeing on television images of little children being bitten by dogs to have people say, this needs to stop. I recognize it's painful. I recognize it's uncomfortable. But it is very important to me that we now have a greater number of people who have the same reaction that I have always had when I am behind a steering wheel and I see a law enforcement vehicle in my rearview mirror. I'm glad that I have company because it will now allow us to have a different conversation than we were having 2 years ago. So how are the children? What does this have to do with the children? It has everything to do with how it is we experience oppression. And particularly for our case today, how it is that we experience racism. And I am absolutely delighted that we get to have this conversation in the year of the 250th anniversary of our submitting a petition of grievances against the government. I think it's absolutely apropos to be reminded that this is something that we are actively engaged in, this bold experiment in how it is that we actually apportion the blessings of liberty and how we secure them to ourselves and to our posterity. So that's my pay into Mrs. Faye Berman, my 11th grade social studies teacher, and I'm gonna bring all of this back together, but let's see what's going on with the children. And I want you to know that by having conversations like this, by you all taking stimulus that you get in the course of your profession and sharing that in conversation with others, that's what really leads to democracy going into action. And we were fortunate that as a result of community conversation, State Senator Brooke and State Assembly Member Clark and the Greater Rochester Health Foundation came together to say, you know, we ought to fund a study and answer the question, how are the children? And so if you run into representatives of those three or those three directly, please do me a favor and thank them. Because people who invest in knowledge, the only reward they get is to know that people are using the knowledge. And so if you can just say thank you as a guy who likes to curate knowledge, it will help keep me gainfully busy and not out here bothering you again. Okay, fair? That's my commercial. So now let's move to the data. The assessment looked at the following focus areas, and these were really built as a result of extensive bi-directional conversation with the community on what are the areas in which we should be focusing our study. I would say to you that as a result, here are the opportunities that we see ripe for 2026. And because I am a regent, and because of the fact that I do chair the Regents Committee on Professional Practice, the regulatory environment, I think offers us a tremendous window of opportunity to really ask the fundamental question, since we are no longer an industrial society and we are now a digital information society, how should we think about professional practice in a way that we could not 50 years ago? Hell, I'll say we could not even 45 years ago, because as much as I know Minitab, that's not a computer language used anymore. So let's jump into the data. First, these are the data that tell us what's going on with what we call the deaths of despair and the drug-related deaths, the growth there, alcohol. This raises questions for me. What is online gambling doing in this space as well? For every data point that we surface, it just raises more. But it absolutely allows us to know that we have measurable data in terms of what's going on with the overall community. And if we look at what's going on with the emergency department visitation, we have confirmation of that which we have been seeing, that the need is leading people to present more and more at the emergency room. And we stand out significantly above rest of state. As someone who has been involved in 2 such ED visits in the course of the last year, absolutely not a surprise to me to see that we continue to be challenged. And these are just indicators. If we go further upstream, we absolutely see these self-reported frequent mental distress, when people are saying that I am so distressed that my functioning is impacted. Confirms what we knew. And given the fact that we have economic pressures that are flowing and that we expect to get even worse, it is very easy to understand the data that we're seeing now may very well just be the opening crest of challenge. And thinking about utility costs, thinking about housing costs, I forgot I had animations that would have caught that to your attention. I just did it verbally. All mental health conditions, to try and take a breakout of what's going on with those presentations and ED visits. Low income, Black, non-Latino, and Latino populations. The place-based nature, I think, is what really creates the alarm. In many ways, it's a closed pool. And the concern is in these ED visits for self-harm that we're seeing among children in the community. When in doubt, the second rule of health improvement says consult the experts. And we really want to express appreciation for all of the providers, the families, the neighbors who participated in this work because they spoke with great candor. One of the things that really struck me was the comment of a young person about the lack of positive affirmations that they receive. And it just struck me that we are not conscious of the need to make sure that we're creating an environment in which we're not cursing the times, we're not cursing the children, but rather offering resources and supports to parents and families. The looking at mental health indicators among high school students. Here are the self-reports that were the sad and hopeless more than twice a day, twice a week. How are the children? The children are not well. Not going to say that our report is full of answers to these things, but rather surfacing the things that we need to be talking about as a community. The government is trying to make moves in these spaces, but I think that there is a difference, the philosopher said, between the things that the heart endures and the things that laws can cure. I think it is very appropriate that we recognize that the day and age of thinking about trying to integrate mental and emotional health care with primary care, those days are over with. We must start talking about how is mental and emotional health centered in primary care, just like it is centered and has to be centered in educational care. It has to be centered in social care. The conversation that we had with experts did identify opportunities that we can and are pursuing. And so there is next step work taking place. And you all at the University Medical Center are very powerful partners, particularly through pediatrics, in the work that we are advancing. School-based supports are going to have to become stronger. And there is an opportunity in front of the state government this year, particularly looking at rural schools, to think about health transformation by having it more closely involved with and more closely working with the school communities in rural areas. And my hope is that if we can model it in rural communities, while we are innovating in urban communities, maybe we can learn things that really can be applied and or inform efforts in all areas of our region. In the event that there are folks who are looking for places to go to link to this work, to understand the work, here's a set of resources that we have available for you. And I want to transition to try and make sure that I have time available for conversation and Q&A. So what I'll do is end my remarks by just saying that one of the opportunities this data gives us is to do a bit of teaching about that African reference of the warriors greeting each other with the question, how are the children? And I want to just say, don't think of that as aloha, how are the children? No, that's tapping gloves and coming out fighting. That's letting you know that the situation between us is so serious. I intend to get it solved, or I intend to die here. And I want to know, how are your children? Because I wouldn't be here if my children were not all right. I want to know how your children are, because you might not leave here. But if your children are not okay, we ain't battling. We are on the same side, and we are going to go get what's bothering your children. Because we can't fight if the children are not okay. I mean to say to you, I do not have time to be anti anything right now. My energy is about the children. How are the children? They are not okay. Wealthy children in the silk stocking area of our region are not okay. Their data is in here. Low income is at risk, but everybody's been impacted. Everybody's been impacted, but children don't have the life experience to process it. They need our help. How are the children? My friends, they are not okay, but they are blessed that they got us. Questions, comments, concerns. My job was to provoke someone to be angry, or provoke not to wrath, but provoke to action. Questions, comments, concerns. We're at half past, and I like to do this more as a conversation than as a talk at. Hand in the air. Thank you. And I got to have a microphone come over first, because we're doing this for the benefit of folks at home. And I will tell you, it will be fun if you can frame it in a true or false mode.
That was not my plan, and I'm a lot more verbose than that. I'll comment by saying that we're working on some community needs assessment pieces for our CCBHC, and I borrowed heavily from this community needs assessment, so thank you very much for that. I know, so if I were asking a true or false question, and I would say, you know, is there a significant discrepancy between, in your graph you showed earlier with mental health symptoms for youth in terms of males and females? It looks like that's true. There's a significant discrepancy with those symptoms. My follow-up questions to that would be, you know, are there any thoughts or suspicions you have around like that significant gender discrepancy in those mental health symptoms in that particular survey? And my follow-up question to that is, did we evaluate our gender diverse youth in that set of questions?
My answers would have been true to the first one, absolutely correct. True to the second one, because I would have had you say, I believe it is due to blank. And whatever you said would have been true. We have a lot of investigation still to do. And I think that that may be a space that really needs segmentation beyond just simply gender or age. And I do not know about the granularity of our segmentation to be able to speak with regard to the gender expression or identity issues. So I'd have said, true, don't know. Excellently done. And see what that does, not to cut off verbose, but it really creates a way for us to have conversation with each other. Because the point is, you're right, important data, but data that continues to raise questions. It's peeling the onion. And every layer makes you want to cry more. But we have the obligation to, first of all, remind people that that's the nature of science. You know what? Pluto wasn't a planet. We asked questions. It became a planet. We asked more questions. It's no longer a planet. That doesn't mean right or wrong. That's the nature of science. You have to talk about it in that level to get Archie Bunker to listen to you. It ain't his ears that's the problem. It's been our tongues. So let's change our behavior. Additional questions, comments, concerns. I have a question here, Sean. See, Sean is Vanna White's cousin, and he did a bad job on wheel, so she won't let him do that, so the U of R hired him.
Hi, thank you for your talk. My name's Kim Van Orden. Am I doing true or false?
Please.
Okay. True or false, the U of R has not yet worked with Common Ground to link our data so we can look at the patient level and the county level data together.
Ooh, I would say false. I'd say the university has been a phenomenal partner in terms of linking data, but we have operated in a 20th century model that we identify the problem, we fill out all the protocols for data sharing, then we apply that and we come up with questions, and then to go explore them, we have to go back all over again. What we have not yet figured out is how do we create an organic and a dynamic bidirectional learning community by which we're actually doing the investigations together. But I can tell you, I've been around since the Earth's crust was cooling, and I go to double AMC meetings, the American Association of Medical Colleges, and we're there as the university with all of our peer institutions. I don't think anybody in the country has authentic, decades-long partnerships around data and data sharing, and no other community can claim what we have done, which is we actually have achieved scientific validity with regard to race and ethnicity in medical records that has evolved to become the standard to which the state is skating. I think that we have a gold crown laid up for ourselves, but we still got a lot of work to do because the children are not okay. Thank you, Kim. Additional questions, comments?
I have a question.
Or am I about to get yelled at? Oh, Chanel's bringing one from online.
Yes. So this is not a true or false question. Is the presence of mental health and substance use resources adequately present in the school system?
No, they are not adequately present in school systems. There is new legislation that went into place last year, and there are new infrastructures that are being built. I think that the picture is going to be dramatically different a year from now, and I do believe, again, we're going to model the way.
Okay, we have one more that's come in. True or false? Has any of the data transformed to funding and or programming to tackle the said issue? Research is nice, but using to acquire results is better.
It is absolutely the truth, but the way that things operate is now that we have the data, now we can go out and we can resource raise. And I think that what should be noted is one of the people who paid for the data was the Greater Rochester Health Foundation. I think that what you should understand that to mean is that funders are very interested in having the data so that they can turn around and justify why they're making the investment, and they can, with a baseline, measure impact. And so I would push, as a person who honestly believes in data and in research and analysis, that they both are co-equal with each other. And the data only has meaning if it leads to action and if it helps us understand why all actions don't lead to good outcomes. Question in the house, if there are none more online, Chanel. Okay. And thank you, folks out there in Radio Land. Please keep those cards and letters coming.
Grand rounds Sean's exercise every steps. So, all right, trying to phrase this in a, sort of true or false question. Social media, right, is a big, component of, to your question, are the children okay? And we can't exit out. How do we incorporate it into improving their health, their mental health, and making sure that they're okay, because it's going to be a part of their lives. and what more can be done to ensure that it can be incorporated into making them healthier?
If the true false is, I don't know what we should do. Do you? I would say I don't. I would say a couple of things, though. Number one is, when in doubt, consult the experts. And listening to parents who are actively raising children and listening to young people themselves is, I think, essential. So when it came to the bell-to-bell cell phone ban in schools, it's very important to me that that was something that was decided by local school districts, not just by the state. And so I'm glad that they came up with the right way to do it, to allow local voices, to allow the affected people to respond. I say all the time, I have no idea how I would parent if I were parenting today. My youngest was born in 98. We didn't have a router in the home until she was in high school. I mean, it was just a very different phenomenon. What I do know, however, is that I can say to young people, you shouldn't be on that thing, because young people do not see me glued to it. I can actually forget where it is because I don't need to have it on me all the time. If we want change behavior, Gandhi is right. It's incumbent on us to model the change we want to see. For me, it's easy. I'm a crustacean. I never changed to begin with. But I think it is modeling, and I think it is listening. And I really don't know anything more than that other than Orwell and Huxley. But I have been rereading my dystopian novels to just remind myself that the stakes of what we are living with are serious. And there's a reason why young people are deeply impacted by it. I just came from an international conference, and I had to talk to Canadians who are saying, no, we really have to take you seriously. We really have to worry about whether or not America's going to invade us. I mean, that's the reality of where we are. And so we ought to talk about mental health is essential. That mental health begins and ends with our connectedness to each other. And all of us have the ability to say that we have been hurt. And so as a result, all of us have the ability to say we're not going to be bystanders on the Jericho Road. That what we're going to do is, when and however we can, we are going to extend help to each other. I think I will stop my answer there. I've got 2 minutes left on my timer before I think I'm going to get yelled at. Chanel?
You are not going to be yelled at. We have until 1 o'clock. So we have 3 questions that have come in. The first being a true or false. Parents, families, and caregivers are adequately involved in development of new programs, initiatives, and health equity solutions.
False. And we have a huge gap that we have to fill. And a lot of it has to do with the fact that I think most of the ways that we have thought about family and parental engagement and involvement are based on life models that are no longer relevant, that fit not even my lifestyle, but Ozzie and Harriet's. And I think we have to rethink that. And again, it's why technology is a very befuddling space for me, because through technology, we should be able to find different and more powerful ways to have people actually exercise full agency. If popular vote can name American Idol, we certainly should be able to figure out childcare.
The next question. You mentioned the positive impact of your parents ensuring you heard you were in the best family, city, and times, regardless of maybe how they felt. Truly heartwarming. Is there any research and application of this approach clinically in work with parents to improve children's well-being? It seems like common sense, but someone will ask me for proof if I mention it.
I would say that the work that I'm following right now is the work around hope. that is being led in the community. I'm thinking of the name of the wonderful scholar who's leading there, and I am an old man and blanking. But there are real examples of researchers who are institutionally partnered and connected with the community, who are absolutely rooted in the ideas of hope and of efficacy and resilience being connected together. And it's work that the county is backing as it's looking at innovations with regard to child protective services and child abuse and neglect prevention. As I remember, I will send the note back so it can be distributed by you all, the project I'm thinking of.
Okay. Any other questions before? I have a couple more, but any other in-house?
True or false, is the project you're thinking about Hope 585?
Yes, it is. Thank you very much.
You're welcome.
And
Dr. Ashley Cross.
Ashley Cross, I
Yes.
was thinking and I could not recall it. Dr. Cross's work is absolutely phenomenal. And thank you for being a light and a rescue for me.
You're welcome. And that was my question, so it's already been answered. So I'm glad I got to pinch hit.
I think that we fail to appreciate the power of hope in terms of clinical outcomes. We certainly know that with regard to surgical procedures from the work that PCORI has done, that mindset of patient is a huge driver of the outcome of the procedure. And our ability to really engage in the relationship conversations that we need with each other so that patients and providers feel comfortable, they feel empowered, and they know that they are resourced to have the conversations about hope and hopelessness, knowing full well that all of us have those moments where we feel a loss of hope. And so how can we have those conversations across the provider line without having a power differential and without boundary violations? Those are things that you all are going to have to help us answer. Those are the things that are going to drive regulatory change, is really understanding what's needed to allow for effective and safe care. Great question and great save. Thank you.
Our next online question, true, false. 5 years ago, the RAISE Commission made a series of transformative recommendations regarding mental health services, largely embedded in communities that have never been implemented. What are the barriers to change?
I would say that's very true. And I think the barriers to change have been our capacity. And I would say over the last 5 years, what I know is I have not been as singularly focused as I could have been. And I'm glad that my organization is allowing me the chance to be repositioned to be a little bit more focused. I think the questions are, what are the things that have kept us from having the conversation that what we're seeing as social behavior has a root in a pandemic that utterly disrupted people's lives? I think what stops that is we don't talk about it that way. We don't have the conversations that we need to have, because this is change that doesn't happen from the top down. This is change that starts from the heart and goes out.
Our next question online, true, false. Key to helping the children become okay is institutions and individuals taking uncomfortable actions, actions that risk political or funding repercussions.
Very true, which is twofold. Number one, why on the chart where we had the different levels of racism, understanding that this is a battle on each of those fronts and the institutional and organizational issues are real. And then the slide where we talked about the 250th anniversary of the Declaration, please keep in mind that there are people who do not believe in any of this stuff. There are people who think that this is all completely wrong. That how if people are sad or blue, that's their problem. It ain't nobody else's. Somebody's drug addicted or substance use addicted, that's because they're weak and they're flawed and they're evil. There are people who simply don't believe this. And we need to understand we are engaged in a great civil war, testing whether our nation or any nation so conceived and so dedicated to this proposition that all people are created equal can endure. And I don't mean to be melodramatic, but we are literally asking the question, can this republic endure? We don't have time to be fussing about anything except how are the children. The fact that I remind, there were children who woke up this morning with bed bug bites, knowing that they're gonna go home tonight. The fact that our county government mobilizes to address that is critical. Where these things are, we have to call them out. We have to talk about them. And I think forums like this are absolutely a gift because they allow those of us who are frustrated in the community to actually know that you all are with us, and allows you all who know that you're under assault because the federal government doesn't care too much for science anymore. Gives you a chance to know you ain't alone either. We got your back. And that's true. Any other questions, comments, or concerns? God bless you.
More of a comment, I guess, in honor of MLK Day. And I think I'd be remiss not to lead with a little bit of frustration and anger in his honor. But there's been a war on Black people in this country since the very beginning that never stopped. And that includes Black children. It always has. And at times, that's not just included them. They have been the focus of that war for a very particular reason. And I think it's unfortunate but predictable. It took this problem affecting everybody's kids for this to be a larger discussion. And that's the reality of where we're at. And if you all haven't watched it, you should go watch these daytime TV shows they hosted with white families being upset about gangster rap making it to the suburbs. Now, these are people talking about their experiences that are impacting their children. And these people are on national television complaining about their kids having to listen to it as if it's the worst possible thing they could imagine, because it was, okay? Just having to hear about it. So the Black kids have never been okay, but I'm glad that we're all finally having this discussion about the children not being okay. And all of that to say that if anybody in this room, you think that this doesn't impact you or it doesn't affect you or it's not your problem, it might not be right now, but it will be if it's not taken care of. So
God bless you.
Thank you.
And I would say 100% on that. And in response, you invoke in Sister Ella Baker, who just quietly and calmly pointed out, until the death of Black men, Black mother sons is treated as precious as the death of white men, white mother sons. We who believe in freedom cannot rest. Cheney, Goodman, Schwerner were the context for that being said. Absolutely, folk are waking up now, but I have to tell you, as a Christian minister, I believe in deathbed confession. I don't care how late you join, okay? So continue to just push them. Martin and Malcolm, the hunter and the drummer, it takes both voices. But what we have to do is understand we cannot rest until freedom comes, until America is America again. if it ever was, as Langston Hughes said. I think we got time for one or two more because my brother gonna get me preaching and I came here to talk about healthcare.
Yes, we have one more that's come in. True, false? Are we preparing children adequately to join the workforce to enable movement out of poverty?
False, we are not, but we are going to, and thank you. If anyone does not know New York Inspires, the portrait of a graduate, please go search that in my Regents World. We have redefined what it should mean and what it takes to earn a high school diploma so that young people will be prepared for this digital information world, not an education based in the last century, which is what our agrarian calendar, I can't even say last century, and I have to start saying 2 centuries ago. But it is implemented at the local level. It will take the work of local districts to make it real. You all must be visible and you must be vocal voices at the local level if we are going to do justice to our children.
Any other questions in-house or online?
I'm in good shape. That gives me 2 minutes to be quiet and then down. And we got 5 minutes on a Zoom out. So you all have allowed me to look as if I were actually as well prepared as my staff intended for me to be. I will tell you, in my faith tradition, there is a story of the master of the kingdom looking out and seeing that the walls of the city were broken, that there were places where there were gaps through which the enemy could flow. And he was not angry, it was said, that there were gaps in the wall. He was angry because there was no one willing to stand in the gap. These numbers are the reality for children in our community. But they only define our children. They only constrain their futures when we allow that to happen. I started with the story of LBJ and Richard Nixon because I want you to know all of these data that we talk about could easily be me. All of these data we talk about are me and my family, but they do not define our community. What defines our community is what I have seen in this complex since my mom started working here in 57 and I became born in 64, and knowing in 69 that the people who care for Rochester and the people who care about Rochester tend to work here at this River campus. And they tend to believe in making the world a better place. And that's what Melior stands for. Betterment of self and betterment of the world in which we live. Thank you for being a part of Betterment.
Thank you. Thank you all for joining us today. I know we have a couple more questions that are online. We'll be sure to respond to those online. Please remember to scan the QR code or on the one that's on the door. Thank you.